Welcome back. My next guest is Ms. Shannon Riddell, who is our Population Health Manager at Family Practice Associates. Now at FPA, we are a Level 3 PCMH. Right. So Shannon, tell me what it stands for, what's it mean, how do we get there?
Well, PCMH stands for Patient-Centered Medical Home. It's a team-based approach to health care for comprehensive care to improve outcomes and reduce cost. Family Practice Associates was one of the first practices in Central Kentucky to achieve that Level 3.
And it takes a lot of work to get there, a lot of detail-oriented care to get there. Now, what are some areas that you focus on so that both helps the patient and us do a better job?
A lot of the areas we focus on are evidence-based guidelines. For example, preventive exams. We make sure that patients have their Medicare wellness exams that are free to Medicare patients. Some other preventive exams we do check on is colonoscopies. We make sure the patients are up to date on their vaccines. But one of our biggest focuses this year is on mammograms. Typically, we would ask a patient about their mammogram appointment or about their mammogram at their physical appointment. Well, we're trying to catch those busy moms that come in for a sore throat. They need to take care of their family, so they're coming in to take care of their sore throat or their cough, but we're asking them the status of their mammogram at those visits because they may not come back to us to schedule that physical. So we get their order for them and get them scheduled for their mammogram and get that taken care of.
So when somebody comes in for a sore throat, you may be thinking, well, why are they asking me about a mammogram? But it's just all about keeping the patient healthy.
Absolutely. Taking care of that whole patient no matter what you come to see us for.
All right. Now, what is the patient going to expect? Is there going to be any difference for them on how they're cared for?
Yeah, one of the biggest changes is TCM, that's Transitional Care Management. One of our care coordinators will contact you after you've been in the hospital and you've been discharged within 2 days. She's going to go over your medication list that you had at discharge, make sure that we have all the medications that you were given at the hospital that you're continuing to be on, make sure they're in your medical record for when you see your provider. She's also going to discontinue any medications maybe that you're taken off of in the hospital. That way, when you get to come see your provider, we try to get you in to see your provider within 7 to 14 days. Make sure your medical record is correct and we have everything that the provider needs to take care of you. That also reduces the cost of and the patient being readmitted to the hospital. That's
one of the things that medical evidence shows, that if you see your primary care provider within that few days after hospitalization, the incidence of readmission are much less.
Absolutely. You know, sometimes patients have a hard time being in the hospital and then they're confused once they get home. They have a long list of medications that they're supposed to be on, and reconciling those medications with that patient before they get into the office to see the provider makes a really big difference.
What is care coordination or team approach?
Care coordination is gaps in cares. For an example, it's taking care of our diabetic population, making sure that they have their hemoglobin A1C every 6 months, making sure they're really taking their medicine like they're supposed to. Sometimes they can't afford their medication, so they may be splitting their dose in half or just not taking it at all, and that's why their diabetes is out of control. So making sure that we can get them into some programs to help them manage their diabetes better. There's some great community resources and insurance programs that have some programs that are free to the patients, and some assistance for programs to get their medications for free. And if not, we talk to the provider to get them on a medication that costs less for them.
Great information. Patient-centered medical home, healthcare centered around you. We'll be right back.